October is Breast Cancer Awareness Month. 1 in 8 women will be diagnosed with breast cancer in their lifetime. And while that statistic is staggering, advancement in treatment and earlier detection has helped decrease the death rate by 44% since 1989. And UofL Health is there with hope. I'm here with Dr. Brian Dong. You are the breast cancer oncologist for UofL Health. And so this is such an important topic to talk about, especially in the month of October. And so really at any age you could have symptoms, and so you really should get checked out as soon as possible. So what are those symptoms that people should look out for?
Yeah, it's so important to have a team of physicians that you can trust if you have these issues come up. So for younger patients, it's going to probably be their OB physicians or maybe their primary care doctors. You know, if you notice a breast lump that you feel like is growing, or the texture feels like it's getting harder, or you have any new nipple changes, absolutely let your doctors know and get the appropriate workup done.
And so specifically for women, when should they get screened?
Yeah, it's a great question, and sometimes it's hard to follow because the guidelines are changing truthfully every couple of years, and even earlier this year in April, there's a big change that age of starting mammograms from 50 to 40. So I would say it's very important to adhere to that and, obviously discuss it with your primary care and your OB doctors. And especially for women that have family history of younger family members getting diagnosed, let's say younger than 40, they may need to start even sooner.
Absolutely. And we hear this term about being high risk. And so what does that really mean?
Yeah, so as you mentioned, 1 in 8 women in the United States are going to get breast cancer, and that's the average risk. So unfortunately, there are women that are just going to be at even higher risk, whether it's due to genetics, whether it's due to abnormal biopsies, or even just family history alone. So, I would say women that have multiple family members or even one family member with a young diagnosis or even dense breast tissue, it's something worth considering. So definitely, pay attention to your mammograms, talk to your doctors. If you need to see a specialist like us, our doors are open.
Yeah, and that is really important too, is finding that team of doctors like you mentioned earlier. So really, how important is that to see someone who actually specializes in breast cancer?
Yeah, so I would say, if one of my family members or if one of my friends were diagnosed with breast cancer, I would want them to see a physician that treats breast cancer 100% of the time. So if you come to see our team here at UofL, I treat breast cancer 100% of the time. So that way there's a level of expertise, there's knowledge of dealing with treatments, side effects, and then coordination across multiple treatment teams, right? So if there's something I need to talk about with the breast surgeon, with the radiation oncologist, all those team members are very set, and we work together very closely, and I would say it's a big advantage for seeing a specialist.
Especially at this location too, which is so great because everything's right here in-house. So if you had a question, you can easily, get pointed in the right direction.
Yeah, very commonly we're in the same building or even the same hall, so that if I need to bug someone or they need to bug me, I just look down the hallway and they're right there.
Yeah, that is so great. And so, we talked about the death rate is going down by 44% in the last, 40 years. And so what kind of research is coming out in the new treatments that are available?
Yeah, how much time you got? So, I would say the breast cancer world is making a lot of advances in terms of catching cancers earlier, which I think is contributing to the lower death rate. And on top of that, we're getting newer treatments and we're finding better places to use them for women with more advanced disease and even metastatic disease. A big part of what we do here is open clinical trials so that we can help our breast cancer patients out here in Kentucky so they don't have to fly to New York or Houston or wherever else in the world. And I would say, we've made some major progress, even the last year, in terms of opening several cooperative group trials with the National Cancer Institute. We're certainly a big part of those advancements in breast cancer.
Well, and that relief of telling someone you're cancer-free, I'm sure that is just amazing to do.
Yeah, and sometimes the journey to get to that point is a lot different for each patient, right? And it's just so important that they get to know me, I get to know them, and it's not just me. I have a huge team that helps support me and the patients throughout this whole process. So you really have to have that trust and that bond to know that you're in the right hands.
Absolutely, Doctor. Thank you so much.
Yeah, thanks for coming.
So if you want to learn more about all the research and how you can get more information with UofL Health, just go to uoflhealth.org.